Hey guys, welcome back to Mediverse Atlas. In today's video, we are going to talk about a very important LAQ, that is hip joint. Now this hip joint is a 10 marks question generally asked, and it is also important in the MCQ point of view as well as reasoning question also. So let us start with the video. In this video, we'll be talking about the type, the articular surfaces and the ligaments of the hip joint, whereas in the next part, we'll be covering the other aspects related to hip joint. Now let us start. Now this hip joint is a type of ball and socket and variety of synovial joint. So it's a ball and socket variety of synovial joint. And what are the articular surfaces? So joint has articular surfaces, right? In the hip joint there are two articular surfaces. The one is the head of femur and second one is the acetabulum. Okay, next, the point which we have to focus here is when we look at the femur, the head of femur especially, we see a cavity called as fovea here. From this fovea there is a ligament coming. We'll be discussing it later. So just remember, from this fovea there is a ligament emerging like this. So this is this cavity is called as fovea. Now in this head of femur, the whole head of femur is covered with hyaline cartilage except at fovea. Okay, now same implies to acetabulum also. So this acetabulum is a horseshoe shaped articular surface. This is called as lunate surface. Okay, it is also covered by hyaline cartilage. Okay, I hope you are clear with the articular surfaces. Now the ligaments, the dry part, the most difficult and the most boring part of the any joint is ligaments, right? Let us try to simplify it. Ligaments, so there are totally 7 ligaments in hip joint. Don't bother with the number 7, but we'll make it easier. So the first ligament is the fibrous ligament or the fibrous capsule or the capsular ligament. The second one is the iliofemoral ligament. The third is the pubofemoral. Next the ischiofemoral. Next the round ligament. Next the acetabular labrum. Next the transfer ligament of the acetabulum. Now let us discuss each and ligament in detail so that our concepts are clear. So the first one, the fibrous capsule or the capsular ligament. So this fibrous capsule is strong, and what are its attachments? Proximally or anteriorly, it is attached to the margin of acetabulum, whereas distally or posteriorly, it is attached to intertrochanteric line. So imagine margin of acetabulum is somewhere up, whereas the intertrochanteric line is somewhere below at the femur, below the neck of femur. So when we imagine this fibrous capsule, it covers the whole joint. Okay, and to be specific, this capsule is thick and firmly attached anterosuperiorly. So this is a very important point to note here is the fibrous capsule is thick and firmly attached anterosuperiorly, whereas it is loosely attached and thin in the posterior-superiorly. Okay, and we need to talk about a very important aspect here. MCQs can be asked from this box. So anterosuperior part of capsule is subjected to maximum tension in the standing posture. Obviously, so anterosuperior part is thick and strong, so it is subjected to maximum tension in the standing posture. And this capsule, the capsular ligament, is made up of 2 fibers. The outer fibers are longitudinal and the inner fibers are circular. So these outer fibers are strongest anterosuperiorly, and these fibers now they reflect onto the head of femur also. Okay, just remember these longitudinal fibers, they reflect onto the head of femur to form retinacula. Just remember these longitudinal fibers forms retinacula. Why this retinacula is important? Because this retinacula, it transmits the blood vessels which supplies the neck of femur. We'll be talking about retinacula in detail, don't worry, in the blood supply. Okay, so longitudinal fibers form retinacula, and this retinacula helps in the transmission of blood vessels which supply the neck of femur. And the inner circular fibers are called as zona orbicularis. Very important MCQ, zona orbicularis. And the zona orbicularis helps hold the head of femur inside the acetabulum. Just it helps in the maintaining the position of the femur. Okay, next, one more important note or the box. So posterior dislocations are more common. Why? Obviously the reason is here, anterior superior capsule is thin and thick and firmly attached. So this is the point. Next, one more important point here to notice, like we can expect an MCQ, sciatic nerve may be injured in the posterior dislocations. Okay, they might ask as an MCQ, which of the following nerve is more commonly injured in the posterior dislocations of hip? It is sciatic nerve. Okay, now let us talk about the second ligament, the iliofemoral ligament. Just try to understand the name, just break down the names in anatomy, guys. So it is the iliofemoral, ilio from the ilium to the femur. The ligament extends from the ilium to femur. Simple. Okay, now it is the strongest ligament of the body. This iliofemoral ligament is the strongest ligament of the body, and it is in the inverted Y shape. And to talk about this iliofemoral ligament, this iliofemoral ligament has two parts. It has apex and it has base. Now this apex, it is attached to anterior inferior iliac spine, whereas base is attached to femur. You can appreciate this thing in this diagram here. You can see, so this is the apex, it is attached to the anterior inferior iliac spine, whereas base it attached to the femur at the level of intertrochanteric line. So diagrams are mandatory, guys. In the anatomy, draw diagrams like this only. Okay, you don't need to be perfect. You have to show the orientation. Examiners expect orientation, not perfection. Okay, next is this iliofemoral ligament. It prevents the hyperextension of hip and prevents trunk from falling backwards in the standing posture. Next, the third ligament is the pubofemoral ligament. Pubofemoral ligament, in the name it only, it talks about pubofemoral, that is from the pubis to femur. Simple, right? So this suppose joint inferomedially, it blends with the capsule, it limits abduction and extension, extends from the pubic part of acetabulum to the superior pubic ramus. You can look at you can appreciate this in this diagram, from the margin of acetabulum to the superior pubic ramus. Okay, see, this is the 2D diagram. In 3D we can see it more clearly. Okay, next, the fourth ligament is the ischiofemoral ligament. Ischiofemoral, from the ischium to the femur. Simple, right? It lies posteriorly. See, all these ligaments, all the above ligaments, pubofemoral, iliofemoral and the fibrous capsule, these all ligaments, they are in the anterior aspect. Okay, whereas the ischiofemoral ligament is in the posterior aspect. Okay, next, it is originated from the ischial part of acetabulum, and it is inserted into the superolaterally onto the femoral leg. How it is inserted? In a twisted manner. So these fibers of ischiofemoral ligament, they twist superolaterally to the femoral leg, and they prevent excessive medial rotation and extension. Don't bother about these movements, guys. If you remember, well and good. If you don't remember, don't worry. Okay, just try the diagram and explain it. Simple. Next, the fifth ligament is the round ligament of the head of femur. We have discussed in the starting that we have fovea. From this fovea, there is a ligament emerging. That ligament is nothing but this round ligament of head of femur, and it is called as ligamentum teres. Okay, the round ligament of head of femur is called as ligamentum teres, and you can look here, the apex, it is attached to the fovea capitalis that is present on the round neck of femur. So apex is emerging from fovea capitalis, and the base of ligament is attached to the transverse ligament. Okay, now what is this transverse ligament? Don't worry, I will be telling about the transverse ligament also. Next, here we have an important MCQ. So this round ligament transfers arteries to the head of femur. Okay, see, these arteries are acetabular branches of obturator and medium circumflex femoral arteries. Here MCQ, how can they ask this MCQ? Round ligament transfers arteries to the head of femur. These arteries are the branches of dash. So these arteries are the branches of acetabular branches of obturator and medium circumflex femoral arteries. Okay, I hope you are clear. If you have any doubts, please do comment in the comment section, or you can directly DM us on Insta. Next, the sixth one is the acetabular labrum. This acetabular labrum is a fibrocartilaginous limb attached to the margins of acetabulum, and it helps holding the head of femur in position. This is not that much important, but just have an idea. Next, the seventh and the last is the transverse ligament of acetabulum. These bridges the acetabular notch, and by this bridging, this acetabular notch is converted into a foramen, which transmits acetabular nerves and vessels. You can appreciate this transverse ligament in this diagram, guys. You can see this is the articular surface, and this is bridged by the transverse ligament, and due to this bridging, this is converted into acetabular notch or the acetabular fossa or the foramen, which transmits blood vessels and nerves. So this is all about in this video, up to the ligaments. In the next coming video, we'll be talking about the relations, the blood, the nerve, and the movements, as well as the clinical anatomy. Thank you for watching. Stay tuned to Mediverse Atlas. Thank you.